Welcome back to the Jonestead. I'm Mary. Today is Tuesday, September 16th, 2025. And I wanted to talk today about what I think is a very critical aspect of what came out of last week's Consumer Price Index report, and that is the healthcare inflation. And I think it's been very underreported, and I think it's extremely important that people are aware of it so that they can prepare. And according to the Consumer Price Index report that was published last week, medical care costs rose 4.2% in August, and this is the highest level in 3 years. Additionally, comparatively speaking, overall inflation is 2.9%. The cost of a doctor's visit has increased 3.5%, and outpatient care has increased 5.3%. And they went on to talk about with this report that large employers are projecting a 9% increase in overall healthcare spending in 2026 and 12% when it comes to drug spending, which is fueled by cancer drugs and the increase in costs there. And we've seen turbo cancers, and I think we all kind of know why that's occurring, unfortunately. And more money coming into that. And then the GLP-1, which are the weight loss shots, which are in high demand, and consumers their insurance companies are footing the bill for those. And so that's adding to the increased cost of healthcare. And I think just overall, the increased cost of everything is carried on down to the consumer. And the insurance companies, as a result, are passing these cost increases on to the consumers, to the people that are private insured or they're being insured through their employees. So it says specifically, consumers that don't qualify for coverage on the Affordable Care Act, whatever, exchanges, whatever they call it, it's the opposite, but could face double-digit premium increases for next year. Double-digit premium increases for next year. And it says these increases are causing layoffs, and of all places, specifically, this is a shocker, Blue Cross Blue Shield of Tennessee they announced that they will be laying off 150 employees. The reason is because the increase of cost to provide health insurance to the employees. So that shows you how bad things are getting. When Blue Cross Blue Shield can't afford to insure their own employees, there's a problem. There's a big problem. And then also, more than half of companies surveyed by benefits consulting firm Mercer said they are considering passing these increases on to their employees. They are considering it, but most of them are actually, instead of passing it on to the employees, are looking to make cuts. Well, guess what that means? They're probably looking to cut employees because that's their biggest expense and all of the benefits that go with it. So you're going to be seeing more layoffs as a result of the cost of healthcare insurance, which is just it's a really big problem. And in my opinion, our healthcare industry in the United States is going the wrong direction. As I said before, we're seeing more and more turbo cancers, and then we're seeing, so they're having to create more cancer drugs, they're making more money. And by the way, the pharmaceutical salesmen sell these to the doctors, and when the doctors prescribe certain medications, the doctors get a bonus. They get paid to do so. So when they're encouraging you, well, have you thought about trying this? Not all of them, but most of them are doing it because guess what? They get a paycheck for doing so. So we're seeing this increase, and on top of everything else, and then the other problem with the health insurance is we're seeing more and more people are having to pay. Our premiums keep going up every year. Pay more for less. So you go in, you assume, oh, well, if I break my arm or something, then this should cover everything. And then you come to find out your insurance company is barely covering things. and the hospital is charging you for every Kleenex that you looked at. And so we, the citizens, the consumers, are on the losing side of this. And we're seeing pharmaceutical companies rake in so much money through the co-flu thing and from just pushing other drugs, and they make a ton of money off of it. And a lot of times, unfortunately, the consumers are harmed as a result of it. So I think this is something really important for people to be considering. On top of that, while they're asking everyone, I don't know what this is, while they're asking everyone to keep spending more, the American people don't have it. And there was a survey recently conducted by PNC Bank, and it said 67% of U.S. workers are living paycheck to paycheck. It says a growing share of U.S. workers are struggling to cover expenses as everyday costs continue to weigh heavily on household budgets, according to a new survey. PNC's annual financial wellness in the workplace report shows 67% of workers now say they are living paycheck to paycheck, up from 63% in 2024. So people are being asked they're getting it from all directions. Car insurance going up, home insurance is going up, groceries are going up, and now health insurance is going up. And some of these things that these insurance companies are paying for, like the fact that they're increasing premiums because of these weight loss shots. That's, to me, something that the consumer should be having to pay out of their own pocket for, because that's really a personal choice of them to do that, and they're entitled to do it. There are other ways to become better fit and feel better, but for some people that does work and they get good results from it, but they're making everybody else pay for it. So I think that's something that needs to be considered. And so with knowing what's coming down the pike, you should expect you're gonna have to pay more for your health insurance, pay more when you go to the doctor, and also be prepared because there are going to be more layoffs as a result of these increases, because the employers are not going to be able to afford to absorb these costs. And if they're not passing it on, guess what? They're going to be getting rid of employees, which we're already seeing. So just be prepared. Keep that in the back of your mind. Try and avoid having to go to the doctor if you stay healthy, and exercise and do what you can and prepare financially the best that you can. It's hard when 67% of the American people are living paycheck to paycheck. And then we also know they're paycheck to paycheck, but they also have debt up to their eyeballs, consumer debt, which is really unfortunate. So just being squeezed. So do the best you can to prepare. It's important to know what to expect so that you're not going to be blindsided. And again, just see if you can set some money aside, be prepared to maybe shop around more for other options when it comes to your health insurance, and also preparing for the potential of layoffs. And we're seeing that layoffs coming for a whole host of different reasons through AI, taking people's jobs and so forth. But it's really sad when in the United States of America, healthcare is bankrupting people. So anyway, I hope you found this interesting and helpful, and it'll help you better prepare to make sure you're not surprised by what happens in the next year or tomorrow. Thanks for watching, and I look forward to talking to you again soon.